Good afternoon, good morning, everyone. Welcome. Just give it a minute or so to kick things off. Excellent. Sounds working well on your end, Dr. Doug?
Yeah, it looks like I can hear everything. I hear you all right.
Okay, perfect. Great. We'll go ahead and kick things off. Looks like we have quite a few people that have joined this session. I'm seeing 40, 45. Okay, great. Welcome, everyone. My name is Mike Rogers. I am the head of marketing at Digitail and really excited to have you all with us today. This is the second of our series on AI in veterinary medicine, and we're really pumped to bring this to you all. It's been a hot topic, obviously, over the last year, but one of the things that we consistently hear at a lot of the conferences and through a lot of our customer conversations is that it's both simultaneously really exciting, but also quite confusing right now in veterinary medicine to make sense of how to use AI effectively to do things like acquire more customers, make sure your clinic is functioning efficiently. And so we started this series to try to demystify AI um, and show some really practical use cases. The first session was a bit more of a high level overview of where we actually are right now with AI in veterinary medicine. This session is going to be even more practical, a zoom in into some of the prompting that you can set up to create different workflows in your clinic. And really excited that we have Dr. Cifranick, also known as Dr. Doug by his 1,200 plus patients. Dr. Doug joins us from South Carolina, where he is the founder and owner of Wolf Doctor on Wheels. So I'll hand off to Dr. Doug in a moment, but the reason we're so excited that Dr. Doug is joining us is because he's long been an innovator in this space. He's helped build parts of the Digitail platform through a lot of his feedback and has been working on a lot of the AI prompting himself for some time. So I'll hand to him in a sec, but I just want to mention one more thing. At the end of this webinar, we're going to be handing out a prompting guide that has over 100 prompts for your veterinary practice. Um, and so that will be free and available at the end of the webinar. So everything that you see here today will be sent out in not just a recording, but a link to 100 plus prompts that you can start using immediately in your practice. And with that, I'll hand over to you, Dr. Doug.
Perfect. Appreciate the handoff, Mike. So as you all know, Dr. Douglas Safranic, Dr. Doug's pretty much how it goes, or most of my clients just call me Doug. Uh, yeah, I have a practice here in Beaufort, South Carolina. Wolf Doctor on Wheels. We're a mobile clinic. For those of you who weren't here last time, and yeah, have a couple dogs, a couple cats, and we're gonna do kind of a quick little recap of last session. So veterinary AI. For those of you who are here, we're going to kind of go through this, but veterinary AI isn't on its way. It's here, right? It is part of our day to day. Those of us who aren't using it, you tend to get left behind a little bit from an efficiency standpoint. Uh, there's obviously dozens of practical use cases available, but what do you want to pick up? What do you want to start utilizing? That's the key to taking off here. Um, Last time we talked a little bit, just start small, right, and expand from there. So, what are the most high impact aspects of your day to day that maybe you struggle with or find inefficiencies with, and how could you improve those and lean into that and start making small applications to where you may be able to increase that efficiency. One thing, as Mike said, right? When I started with Digitail back in 2020, it was a partnership mindset, and AI is no different, right? You've got to be able to refine it, work with it, improve as you go, and as you do that, and you learn, it learns from you, and outputs and efficiencies skyrocket. So, kind of getting into today, the nitty gritty of AI prompting. Let's start with what is an AI prompt? A prompt is the question, command, or context you provide so that AI knows how to respond. So essentially, we can think about it as almost instructions for a very fast, but very literal new associate, right? It's going to only give you back the information that essentially you request, and often in the manner that you request it within those guidelines. So I find often, even when you ask or talk to your clients, if you lead them to an answer, you're going to get a very small set, or if you don't lead them to an answer, sometimes you get a very broad set of responses, and often we need to refine that in as we ask those questions, right? Ideally, yes, you want to leave it as generic as possible to start with our clients, and narrow that in as we go. With AI, we almost want the opposite, right? It's really refine exactly what you're looking for, create parameters to get a consistent response with information that is accurate, right? That is the key. So why do prompts matter? Kind of hinted at that, right? Quality, intent, speed, output, and accuracy. Those are kind of the five main keys here. So quality, we want to control the quality and the relevance of what AI's output, right? There's a broad set of information that this can pull from. And so we want to make sure that it is consistent and relevant to what we want. Intent, the intent that you give it helps AI actually understand your intentions and the tone in which you want to deliver the information. Speed, obviously AI can help speed us up significantly. But if we have to go through and edit and constantly change and constantly correct the outputs that it's giving us, it may not, that efficiency that we're talking about starts to significantly decrease. And so, as it says, reducing that back and forth so that you get those answers the first time, not the fifth, sixth, seventh time. As you learn, you may be on that five, six, seven, but as you get better and as you get better creating prompts, right, that efficiency skyrockets. And output determining how specific or creative the response will actually be. You get to control that a little bit, and that's all in that prompt that you generate. And again, as we mentioned, accuracy here. All right. Um, the one thing with this, and it's kind of a takeaway right off the bat, 30 seconds of writing a more informed, accurate prompt could save you, like I hinted at, 10, 15 minutes of editing, which at that point does not really create any speed or efficiency for us. So, as an example, what are the difference between good and bad prompts, right? I actually will do this opposite. What's a bad prompt? A bad prompt would just be a singular, no information, no input, write a soap note from this transcript, right? Well, that leaves that so broad, so generic that the range of outputs that you could get will be significant versus a good prompt that is specific, clinically relevant, and ready to edit output, right? Parse the transcript from a veterinarian's examination. I probably wouldn't use the word parse, but that's just because my capabilities of language are pretty limited. Uh, the SOAP should populate only the objective, examination findings, assessment, diagnosis, differential diagnosis, plan, treatment plan, and general recommendation section. Leave the subjective section blank as patient history was gathered separately. And we'll kind of talk about why that is. For me, right, when I write these prompts, I don't necessarily do that. I'm mobile. So I see the clinic, I see the client from start to finish. And so I'm essentially doing that entire intake and every process in one visit. But in a brick and mortar, right, in a more standard setting, if this is an ER, if this is your general GP, even, other specialties, the expectation is that that subjective section and some of the intake will be done by maybe your technicians or your assistants, the front desk, whatever that may be. And you don't necessarily want to be overwriting what they're doing. And so that all of that creates, again, a consistent, I guess, consistent follow up to what's already been generated and creates that consistent output. So let's talk about, I guess, the anatomy of a great veterinary prompt, right? There's kind of four main components here. This diagram kind of gives off the idea of a hierarchy, right? And to a point, maybe there is, but essentially they are four pieces that are equally important in creating a consistent, accurate output, right? So what are those four? So role. Start by telling AI who it is, right? Sets the knowledge base and the tone. My name's Dr. Cifranick. I'm a small animal mobile veterinary physician, and give them that information. Who are you? Essentially, what do you do? And then the task, say exactly what you want. This is going to prevent AI from guessing what you need, right? So if you're talking about a soap, if this is discharge instructions, whatever it may be, tell it exactly what you need, and then give some form of context to that. Give the clinical situation and provide the raw material for AI to work with. If that's, pulling in lab results through a PDF, if that's copy and pasting something, if that's a transcript of an appointment, whatever that may be. And then the formatting, after you've given it those three pieces, you need to tell it how you want something output. So specify that output structure, and it gets you a usable result the first time, right? There's still maybe some small editing, but the bulk of what you want tends to be repeatable, accurate, consistent output. So let's get to how comfortable is everyone writing AI prompts? Is this something we're doing? Is this something we're playing with? What are you finding?
Great. I think the question should appear on the screen there. I'm starting to see some answers flow in. And it looks like we actually reversed the questions here, but the first one, it's okay because this is they were both relevant questions at this point anyway. What's your biggest documentation challenge is the first question that popped up there, and it looks like we're seeing a pretty even distribution. Soap notes take too long, after hours charting, inconsistency across team members, the second highest so far. All of the above. Yeah, it looks like so all of these are hitting striking a chord, Dr. Doug.
Perfect. So essentially, all pain points in documenting and charting in every clinic, everybody's experiencing that, which makes sense, right? These are the time heavy things that nobody really got into veterinary medicine for, right? In any way, shape, or form. Admin work's the bane of most people's existence in the veterinary field. That's not what we enjoy. So it makes sense that we kind of have an even spread or a fairly consistent spread across the board here. All right, so we're gonna slide into let's start with soap notes, right? This is as veterinary professionals, as veterinarians in general, this is where our day disappears, right? This tends to be the holdup in between appointments. This tends to be the thing that gets kicked to the back burner. This tends to be the thing that gets pushed to the end of the day and results in you being there a lot longer. On average, let's say it takes you 15 minutes on average per soap. Obviously, that's different with everyone. Everybody documents at a different speed, but tends to be the faster we document, the more things we're probably leaving out. As I mentioned, after hours charting, uh, it's one of the top burnout contributors, right? General workplace stress and just time that we spend at the clinic, right? Let alone mental burden is huge. And so it's a huge contributor into veterinary burnout that we experience. If you're worried about these kind of things, the emotional aspect that throughout the rest of our day, combine that all together. And we're seeing that consistently across the board. As I mentioned, incomplete records, right? You're rushing between appointments, you're just trying to jot stuff down. For those of you who remember back in the day, right? Writing down in a pen and paper, and you'd get some very old school veterinarian that would leave you, 3 lines for an entire exam, maybe one little thing of notes with a medication. It wasn't very thorough because they're trying to parse through everybody they got coming in for the day, the walk-ins, the emergencies, the scheduled appointments. That was fine at the time, but later down the line, well, what actually happened? What did they see? Did we mention this last time? It definitely makes a big difference. Uh, you know, if we're talking about 20 patients a day, 15 to 20 minutes on average. That's 5 to 6 hours per day of documentation. It is a huge, again, this is part of that burnout. That's a huge component of our day. If it's mental burden, if it's who we can actually get to see, creating efficiency, we talked about it in the last webinar. you can increase the number of patients just because you're spending less time documenting, but it doesn't mean you have to be less thorough and less complete here. And then that kind of inconsistent notes. So we'll kind of get into actually, building a SOAP note prompt. Um, so again, kind of repeating role, task, context, and format. So role. Let's use an example here. You are an experienced veterinarian documenting a patient visit at a general practice. Right? We can edit that for our specifics and what we want. The task. I need you to write the objective, assessment, and plan sections only. Again, expecting that for majority of clinics, subjective will already have been handled. Do not write the subjective. It was captured separately by a technician or assistant or whatever your workflow is at your practice. Include a differential diagnosis list ranked by likelihood. Include recommended diagnostics, right? And then for context, using the patient signalment, presenting complaint, history, and physical exam findings provided below, generate the note. Only reference findings that are explicitly stated. Do not assume or infer any data provided. And our format. Use bullet points for the plan. Limit the differential list to 5 items. Use standard veterinary abbreviations, whatever they may be, and keep the assessment to 2 to 3 sentences. Right? And you can break that down however you want, but this again creates those consistent outputs. And so, for an actual example, I'll kind of pull up some of what I tend to have written here. So I'm going to pull over. This is my mother's dog, Gracie. And to be able to create consistent SOAP notes, I very heavily lean into transcripts and documentation through recording my appointments. And to accomplish that, I'll kind of take you. This is a little bit, obviously, we're using Digitail. So for me to accomplish that, and over time, I was finding that I was getting very inconsistent outputs. And so in my ability to control what I'm seeing, right, I've been able to create sets of rules for myself that are generated throughout the clinic, right, for all team members, but then each individual is able to go into their personal rules. And although it's a little bit of a jumble, I've been able to create specifics or areas where I found weaknesses in generating those soaps. Okay. And so just to kind of take you through here, you're able to see I've created a series of rules that helped me narrow that in. And so let me go back to the beginning here. So Gracie. All right. So we will add a soap, act like we are working our way through. Mine again generates a subjective. So start this, and I typically record. I do this from my phone. So Gracie presents today we'll just keep this simple, for an annual visit. She is due for a rabies vaccination, a distemper parvo, parainfluenza and adenovirus vaccination, and a kennel cough vaccination. She is also due for a heartworm, Lyme, or Lichia anaplasma test. On presentation today, the owner noted that she is eating well, no vomiting, diarrhea, drinking, eating normally. Did note that there's a slight limp in the rear right. Has been happening for the last 2 to 3 days. Seems to be improving, but she did want it examined. All right. And then on examination, dentition, I tend to summarize. This is an example, I guess. I'll pause here. I tend to summarize pretty quickly on the things that aren't, and consistently, as most of you will. But dentition along the entire cascade was normal. Both eyes bilaterally normal, ears bilaterally normal, heart normal rhythm, normal rate, no murmurs, lungs clear bilateral, abdomen soft, non-painful, skin normal, hair coat normal, no neurological abnormalities noted. There was a slight gait change on the right rear leg. Normal range of motion through the hip, negative cranial drawer, negative cranial thrust, long bone palpation normal, no joint pain noted. We are recommending, based on that examination, rest and exercise restriction. We are going to start her on a short course of carprofen. I want to do, based on her weight, a 100 milligram tablet, 1/2 tablet every 12 hours for 5 days. And then we will have the clinic check in on day three for a callback, right? And so we can let this generate. They'll try and scrub all of our voice. And then based on the rules that I've set, right, we'll let it generate those SOAP notes. And so you can see moves nice and quickly. One of the things that I've also done in the background is created consistent outputs for my objective. So essentially defining what I want that to look like, which again, in Digitail specifically, you can do in the administrative settings so that however you want these to be generated, they will be. And that's obviously to your preference. So it takes a little bit of work. But because of that, we're able to go through, sync that, and place it wherever it needs to go. So for me, again, you're going to see there's kind of an internal note section. And the subjective fills for mine because again, the way I do it, but if let's say you did not want that output in there, you could create that in your personal rules. So owner Stacy Cifranick reports that Gracie is here for annual health visit, due for rabies, kind of everything I repeated there. You're going to see in the clinical examination, this coming through, right? I did not mention pain specifically, and I did not mention body condition score. So again, things that I'm not seeing as I'm going through and reading, I may notice like, oh, I forgot to notate that. In my recordings, typically in my examinations, I notate that while I'm sitting with the client as I'm going through my exam, so it picks it up and automatically inputs it here. I very rarely, unless I have no internet for some reason, and even then, I'm able to record on my phone without it, and it loads later. That I'm able to notate all of that during the exam to catch all of those things, and it will fill accordingly. And then for our assessment, based on what you're seeing, it's going to note the big things that we saw, right? However, we create those limitations, and it's going to create a ranked list of differential diagnosis based on the most likely to least likely. Again, would have notated that I expect that some sort of, ACL sprain at that point. That would have been my expectation, and it would output that accordingly. And then going into your services and products here, for me, it's going to actually talk about treatments. While I'm in my recordings, I tend to notate where I'm putting a vaccination, rabies right rear. For me, I tend to do distemper right shoulder, and kind of consistently have that. It'll also notate that all in here. And then recommendations it'll create based on what I stated. And as I'm having a conversation with the owner and making those recommendations, it's putting those together, generates it here. And then for me, I'm able to create a set of discharge notes for the end of the appointment if the client's ever confused. So they actually can follow up. Whatever the diagnosis was would be put in here. Okay. Medications and products, as we actually put them in and charge them, they'll show up here. You can create AI enhanced care instructions depending on what you want. I tend to not need those because this tends to populate what I need. So I just kind of unclick those. And then those general recommendations I can just send off in a quick email to the client. All right. So now, if you're finding that outputs are inconsistent, right? This is kind of like dating, right? It's that breakup call. It's probably not the AI, it's probably me. It's one of the things that I find if I'm getting variable generic outputs, I'm probably not doing my part with the AI to create that output in the manner that I expect it to come out. And so what if the output is wrong, as we talked about? We need to identify where we created, I guess, a vagueness, right? Is it too vague? If it is too vague, you're finding it to be too generalized, there's not enough information, right? Add more context, species, signalment, specific findings. For me, when I started working with the AI and Tails that was working off of my recordings, right, I found it to be too vague with growths and skin abnormalities, lipomas, locations. And so one of the rules that I created as I played with it, right, was to specifically tell it not to summarize those or not to discount those into just multiple lumps, multiple growths, multiple lipomas, warts, whatever it may be. If I make a specific note of saying, I noted a wart on the right shoulder, I noted a lipoma, just cranial to the thoracic output, if whatever it may have been, I want it notating that specifically and then listing those growths so that I come back in the future, I know where to look at and where to check. And making that change, right? I now get consistent outputs on all of my derm that I talk about. Is it making things up? If we're finding that there's information there that we didn't include, add constraints. Only include findings explicitly stated. Do not infer normal results for body systems not examined. And that may not be what you want. You may find that if you specifically didn't notate something verbally or you didn't put something in, you want your SOAP to generate a consistent output of, yep, normal, no findings, or whatever it may be. And again, that's a rule that you will have to find and play with. What if it's in the wrong format or it's a variable format? Well, be specific about that structure. I want the specific format of SOAP with bullet points underneath. And again, going through Digitail, or any of the potential other AI transcribers that you're using, voice to note applications, you can generally put in, right, a specific format of not just the SOAP, right, not just your SOAP, but how you want that written so that it follows exactly the format that you would typically use as you write notes manually. One of the things and one of the big steps here, right, expanding the prompt, don't start over. All right. So rather than starting from scratch, if you're finding that the input is incorrect or the output, excuse me, is incorrect, start adding things to what you've already given it. Add a line, don't rewrite. Even single line additions can dramatically improve outputs. All right. So do not autofill normal findings for unexamined body systems can often solve the biggest clinical accuracy problem, right? That you may run into if that's an area of concern that you find. And then once you start adding and narrowing down and getting a consistent output with what you're doing, and it may take multiple iterations of editing the first few times that you utilize it, save that as prompts, right? Create that as rules. Put that in the back end of the system to create a rule. And you may even find that as you make those edits, you have to go back and change a rule over time, right? It's not generating what you want. All right, so SOAP notes prompting, best practices. All right, we've kind of already hit on this a little bit, but one of the main things would be split by role, right? Specifically in this system, you're able to create those personal rules. Every account is. And so they can create limitations or you can provide them with limitations, right? On onboarding and as you create accounts to help them follow the workflow of the practice. And so, for example, tech is capturing this objective and vitals, right? So we want theirs to limit to just those things and not fill anywhere else. And the vet themselves completing the assessment and plan, right? Or that, again, objective assessment and plan. You specifically state what to leave blank. I do this for my telemedicine visits, right? I have a set of rules in my personal rules that state if I start the SOAP or the recording, right, with this is a telemedicine visit, it knows not to put anything in the objective section, right? I didn't physically see anything unless there was something specifically noted by the client, a wound, something that I target specifically, whatever it may be. It's not going to fill any information in there saying like did not examine or try and just put in normal information. It's going to obviously, this rule is obviously important to prevent AI from filling in sections without data or duplicating sections specifically because you didn't notate it and you'd have a subjective or those vitals. And because you didn't notate it, it'll then place it as a secondary filler there. And then how to handle missing data. Again, either autofill normals, this is preference, or leave them blank. And that is something that you need to choose intentionally. Match prompts to visit type. So this is also important, right? Based on the visit type that you can set or that you define at the beginning of the appointment, you may want specifically different outputs. And so create those rules, create those templates to say if this is a wellness or a surgery or a recheck of a previous visit or a call, or for me, again, a telemedicine visit. I tend to do a lot of those being mobile. They require a different SOAP structure. So give it that information. 5 being used prompts for edge cases. So multi-patient recordings, language needs, or decline diagnostics. And then also review before charting. Okay. So AI drafts, clinicians verify and finalize, or always review, excuse me, before charting. Um, you know, I find that one of the things that really hammers me, right, is the at the end of my visit, right, I need to just go through and edit that out. There may be random information that a client provides. I'll go through that recording and be able to kind of take out specific information. I'm in the middle of an appointment, especially being in a house. They may include information on another pet. I may even need to add that as a restriction. Anything that was notated specifically stating about Fluffy because we were here to see Pumpkin. If they throw that in, it can create a little bit of a jumble. But if you specifically notate that, again, create those rules, it tends to help you minimize having to go through and pull out information that wasn't about that pet or about that accuracy. And again, being a mobile vet and being in the homes, clients try and include information about a lot of patients and a lot of pets in the house, their friend's dog, something they saw that can definitely send my soap notes awry if I don't have those rules in place or those restrictions in place. So we kind of already did this poll, but what's your biggest documentation challenge? We're going to flip that and run the other poll that we had prior,
Yeah, exactly. Give me
and
one
it should come up on
second.
the screen here in a second.
There we go. So this one's all about familiarity with AI
So this
prompting.
is AI prompting polls. How comfortable are you with AI prompts in veterinary medicine? Right, we kind of flip those back and forth, but still relevant to the conversation today. Never tried it. I've experimented a little. Use AI regularly, or I write structured prompts to this point. And if so, you're probably ahead of most people. I would say most of us, especially as we start AI, are kind of using defaults, and it's a practice, right? To rather understand what we need to do and get those consistent outputs.
And it looks like so far, over 80% of the audience has either never tried AI prompting or has experimented a little bit. But using AI regularly and writing structured prompts has less than 20% at this point,
Okay,
which
which
is,
makes sense.
yeah,
That's why
makes
we're
a lot of
here.
sense.
All right. So we kind of have talked about soap notes. We've gone through that a little bit. That's obviously one of the major pain points, administrative tasks that we find. But what are some of the other things that we're finding? Well, client communications is obviously one of the other components of this that is monotonous and time consuming, right? As we see them. But it maybe, at times, I would say on an equal footing, if not sometimes more so with soap notes, right? It has higher stakes, right? It's the touch point to the client. It's what they receive from us, and either can leave a very bad taste in their mouth or make you look like a rock star, right? My clients are always amazed at the thorough blood work results that I'm able to generate for them, or the discharge instructions, or summaries of the appointment that day. And it's the AI, right? I'm able to can create those consistent outputs, and it makes us look really great. But the time it took to do it is very minimal, and that's all. It's something we see even in our reviews online, right? And so, personalization, right? Every patient visit needs discharge instructions, and you write them from scratch each time. If this is for a surgery, if this is for those recommendations that you made, whatever it may be at each appointment. Forgotten follow-ups, check-ins, callbacks. Again, clients have an expectation, especially if we promise something, and if stuff falls through the cracks, which it can happen. And over years and years of doing this, right? It happens all the time, unless you create a consistent plan. And having AI there to assist you is like groundbreaking, right? The emotional drain, writing these, generating them, you're tired. Especially sensitive communications. What's the tone of voice that they're using? It can be a burden. Um, 10 minutes of client confusion. Lab result emails take 10 minutes each when you're explaining abnormal values in plain language. I would tell you mine probably take longer than that. Maybe I'm slow by it, but when I historically wrote them, I felt like it was lab result emails were tedious. I'm someone personally, I've had a lot of medical issues. I'll share a little bit. I was diagnosed with cancer on my 29th 30th, right before my 30th birthday. And so I've done a lot of human lab work, a lot of stuff done to me. And one of the things that I always disliked, very much so, was that I'd get lab work, have to wait for results, schedule a follow-up appointment. I'd show up to a clinic, right, or to my doc. They'd go over the results, but maybe I wasn't seeing a copy. And then afterwards, I'd see the results and go, well, what about this and what about that, and why is this elevated, or why is that hormone slightly elevated? It's one of the ones that you've been concerned about, but you didn't mention it at that appointment, and then have to follow up with them, try and find time to get a phone call, try and get them on the phone, just like we're seeing in veterinary medicine. Often you'll want to go over examples of things, but the clients may have follow-up questions because they didn't read the results, and it can extend either phone calls or creating those emails. For me, I always want to be extremely thorough in my follow-up lab results, and by being that thorough, right, it tends to minimize that phone time for me, and I only really have to set up phone conversations with clients that need a follow-up questions. I made a recommendation. I have more questions after that, minimizing that overall time that I need, but they're extremely happy with the results that get created. You don't want your AI guessing the tone, right? Depending on what we're trying to deliver, if that be again, sensitive results indicating like a critical illness, or something with an extremely guarded prognosis or poor prognosis. It's critical and how that news is delivered. And if we, deliver something in a tone that's very casual, it may come off, being a bit dismissive, or being a bit, maybe even callous or cold. And that's not our goal. Again, leave those good touch points in clients' mouths. And then inconsistent, right? Inconsistency. So inconsistent messaging when different team members send different versions. So trying to create, a uniform voice across the clinic, so that the client starts to get a feel or a temperature for your group, right? So just like we did before, building discharge instructions prompt, there's going to be four main components here: role, task, context, format. It's consistent. This is something we need to do every time. So for an example, as a role, you are a compassionate veterinary professional writing discharge instructions for a pet owner. Use plain language, no jargon, write at a sixth grade reading level. In my personal prompts, I tend to select eighth to 10th grade reading level, and I give it that variety. So it does create a little bit of higher level information, but still discusses it in a very digestible set of knowledge. Task, write post dental instructions covering what happened during the procedure, the medication instructions with specific dosing, feeding restrictions, for example, soft food only for 10 days, activity restrictions, signs of complications to watch for, and when to call the clinic, and with the recheck appointment date. And then context, using the patient name, procedure performed, medications dispensed with the dose, route, frequency, and duration, and any post-procedure observations provided below. Generate personalized discharge instructions, only reference details that were explicitly provided. And then the format, use short paragraphs with headers for each section, bold the medication names and dosing, and include a when to call us section at the end with bullet points for warning signs. I find that for the format, I tend to maybe create more restrictions than I create specific guidelines, I guess, in regards to the templates. I will tell it to use bullet points where appropriate, in summaries, but I like a slightly varied format for mine. And part of that is because it then creates, I guess, maybe the intention that I'm generating these individually, and if it's the exact same every time. So I want a little bit of variety in my format, but that's a personal preference. That's something I found. For other groups, you may find across your clinic, especially the larger your clinic is, right? This one's being only myself and my 6 employees, that a little bit of variety for me is okay. And so I'm not as specific there, but you will find your kind of personal preference here. And so for an actual example, right, for a discharge as we've used, what I have found, right, we'll use, if we can do this, perfect. We will use Gracie again. I have found that my preference, right, is to generate discharge instructions in tails, right? I have done this in the past. I will jump into tails, ask it to create a more generic set of instructions that are consistent across the board, And then for me, right, what I will do if I'm at a surgery, if it's a dental, if it's something specific, I use Tails Help to create a uniform set of discharge instructions personally because I'm able to create specific recommendations to that patient and that client inside of the SOAP itself, right? And so let's say we are doing one of these surgical discharges and the procedures, right? If I need to go into the like a spay neuter for the additional notes, or for me for dentals, um, right? You're going to have client communications. You're going to have areas that you can put things. I tend to generate them still inside the recommendations. And what I will do is I use text plays alongside Digitail. And so I'm able to create a set of consistent discharge notes that way. It's just my personal preference. Where let's say it would be dental discharge, right? Which has, oh, if it's, yeah. And so my notes were created using AI, right? But I know that they are consistently the same every time. I deliver them the same way. I can make a small edit accordingly. And then anything outside of what I already have recommended is covered here. That's specific to the patient. And so I'll go in, dental discharge instructions. I went through and specifically created exactly like it talked about the output that I wanted here. And it's consistent across the board. The inside Tails itself or inside Digitail itself, right? We can go into the discharge notes and let's say, I'll just jump over there now. We talked about that Tails AI enhanced discharge, right? Similar to what we were seeing before. You're going to come down here and you can generate AI content. Okay. So we want to create a set period of discharge instructions. We're going to let it do its work. You can kind of do that in the background or while you're still doing the dental, right afterwards, let it generate what it wants. And then based on that prompt, we're going to let it work here. It takes a second.
And
That
Dr.
could
Doug,
actually be my
while
internet.
that works, we have a couple
Yeah,
of questions that we might be
perfect.
able to answer in the meantime.
That's great.
Sylvia is asking, how do you keep the AI from forgetting from chat to chat if you have a big project? Uh, so I think potentially this is a question of continuity between chats, but I think I'll let you provide the response there. But I think it's probably connected
Hit
to,
me with that question one more time just so I can digest it properly.
yeah. How do you keep the AI from forgetting from chat to chat if you have a big project?
So if this is so it depends on what type of AI you're using, right? So if you're using something like Digitail specifically, we can use that as an example here and then we'll go to something else. Digitail, the benefit is, right, client communications, emails that are sent, those are going to get added to the database of information that Tails is pulling from, right? As I send, while we're doing this, let me see if I can actually pull up a second set. So I'll kind of use this as an example case for, let me actually jump back over to Gracie because Nemo, well, actually, this will work. Nemo is my personal dog. Just confirmed she had lymphoma actually in the last week. So if let's say I was the client, right? I have a set of prompts here, and typically for me, this is how I generate all of my lab results, right? This is how I generate the emails that go out. And I want to summarize the most recent lab results in the form of an email to the owner and let it pull that. Well, because it's the most recent, right? It's going to immediately go into the database that has been generated inside of Digitail through SOAP notes, through client follow-ups, client communications, uh, again, intakes, whatever that may be. I again have a kind of prompt set up here. A lot of that'll be shared at the end of this. That'll help us generate a consistent set of results. And then I tend to let it create recommendations based on my history. It's learned from me. It knows it's pulling from all of that background information, the rules I set in the background, right? And then what I do for this, I tend to copy these and go to a send message. When I do that, generate them in here, right? It does a nice real job here. Again, using text plays, I have a little prompt so that it knows what I want and how I want it output. It will create that. As I send an email in this system, right, I'm able to go into something like the health card and under the health card, it will automatically generate outputs in the client communication. So as I move forward, it's pulling all of that information and it knows, right, based on the constraints that I've given it to do that. In my personal, right, I'll pull this in, like my personal chat GPT, you'll see that I've created something like Wolf Doctor Marketing Guru, right? That's specific to us. And to do that, I've created a set of guidelines when I started working with it that gave it that information and told it how to pull things, what I wanted, the tone I want, how to do that. And I'm able to create inside these projects specifics that I want so that I know I can go back to the specific project and it will follow the rules that I've outlined for that project. And so it really depends, I guess, on the system you're using, right? If it's something like a PIMS where it's pulling that consistent data, you're able to put rules in the background, it's going to build and learn with you. If it's something like Claude or ChatGPT, Perplexity, typically in a specific project, right? You can make projects similar to this. You can do exactly what you talked about. What's your role, right? What are the tasks that you're trying to accomplish? Give it the context of what you're looking for, and then ask for specific outputs. Create that right off the bat, how you want it, what you want done, and then as you go back to those projects, go back to those different threads, you can use that and create those predictable outputs, and it will pull from previous information that you've used if you tell it to, right? You may even tell it, well, ignore everything prior to this minus the rule sets that I've given you, outputs, instructions. I need to generate something new from this and use that previous knowledge or don't. And it's part of that instruction that you give it. Again, this is that very straightforward, maybe new to the world veterinary associate or marketing associate or business partner, whatever you're trying to utilize it for, it's only going to give you what you ask and how you ask it. Or it's going to go haywire, right? Because you've not given it any guidelines. You just said, write me a SOAP note. Well, it has no background on what you actually want, how you want it output. So a little bit of play. And again, it's part of the learning process as you go through this. But something like Digitail or other PIMs often have rule sets, even as default settings, that you may be able to go in and just edit, right? You don't have to often generate them from zero. It's just a matter of editing based on the outputs that you're seeing so that it's more consistent going forward. And so it really depends on the database that you're working with. But I hope that answers that for you. It was maybe a little longer than I intended it to be, but. So going back to Gracie, we were kind of working on like a discharge instruction, right? Having something like Digitail generate a discharge instruction. You may find, right, that this tends to operate on a very consistent manner. You're able to put rules in when you're talking about discharges and how you want them to operate, depending on the type of discharge. But you may find that like this is too wordy, right? There's just too much here. The client's not going to read it. There's too many confusions. And so what you may find, again, generating rules, you can add additional instructions, right? You want to focus more on medication details. You want to simplify language. You want to shorten this significantly. Keep this to, if it's too long. So keep the discharge instructions to less than 500 words, right? And that may be too short, but we're just going to use it, and you can save those for the next time. So as you use it and build and grow with it, it gets more consistent, right? So the first few times it's going to be maybe a little choppy. You're going to have to edit, but if you're able to do that, right, you apply that personalizing recovery. I didn't click save here. But we'll let that work in the background. Mike, do you have another question while we're working on that? We're jumping back and forth here a little bit.
Yeah, we do have another question. It's from Melissa Benway at Oceana, and she asked, let me just pull it up here. Can Dr. Dove give an example of how he uses prompts for multi-pet appointments?
Yeah, so for multi-pet appointments, what I have personally found has worked best because of the way that I'm doing the recordings. I tend to operate on a fun little Tails VIP app on my phone. And I'm able to pause and stop my recordings, right? More than anything. But when I find that I'm not able to do that, what I tend to do is specifically note inside of Digitail on that recording, right? Because I still save all of my recordings and transcripts, and I may be able to use a transcript for multiple appointments. That what I'll do is, let's say we go back into one of these SOAP notes, and this has worked. So this draft, right? Then I can go into this quick soap and I can pull from my recordings, right? So for example, Nala and Cole from today, that I have still yet to finalize my notes for, as I didn't have service at the appointments I was at. I'd be able to go in, import that soap note, okay, in, and what'll happen in Digitail, it'll automatically take it over to an archive. Well, if I go to the next patient, I can just unarchive that same soap note, right? That transcription. And they give you in these other findings, I tend to either use that or additional instructions, right? To say, and when I record multiple patients, I tend to make sure that I either repeat what a client has stated, right, to minimize confusion and say, okay, so now we're talking about pumpkin, and let me just reiterate with pumpkin, this is what we're talking about to help minimize that, because if it's too jumbled, AI will always struggle to pull out the exact information that's appropriate for the client. So it does play on you a little bit to just maybe refresh its memory and say, okay, pumpkin, let's just refresh. This is what's happening. This is what you're seeing. This is what medications we're using, whatever it may be. And you don't always have to be that specific, especially if it was highlighted really well before. And then for here, in those additional instructions, I would state, I need you to pull all the information that was created in this transcript specific to pumpkin and only to pumpkin throughout that transcript. And I would tell you about 99% of the time it pulls exactly what I need it to, because I make notes, because I found it was a challenge in multi-pet appointments, that I make little stop gaps in there and specifically state their name again. And then once they're able to do that, it helps me generate a much more accurate soap based on those multi-petters. But again, I tend to, when I can, just pause or finish transcription, and then jump to the next pet and just reiterate maybe some of the stuff that they mixed in with my past appointment or with the past appointment at that specific visit. And so there's you kind of have to feel it out in the moment. I will have to say AI does struggle there a little bit, but it's gotten much better as long as you create, again, parameters for it.
Awesome. Yeah, very helpful. We have a couple more questions that I'll save until the end because I know you have a couple more slides to get through, Dr. Doug.
Yeah, we do have a
But
couple
I'll throw a
more. So, for
couple.
example, again, this instructions that I gave here weren't specific enough to say each section, right, versus the totality. That was again, it's me, not the AI. I didn't give it specific enough guidelines here, and so it's better, right? This is not quite as wordy as it was before, but it limited each section to 500 words, not the totality. And so, again, just give it that guideline, and you tend to be able to improve over time. All right. Um, so went through a couple examples there. So again, going through this, we do have a few more slides to get through, so I'll probably move a little more quickly here so we can get to a couple questions at the end. Again, what if the outputs are wrong, or it's out missing a when to call section? For example, include a clearly labeled when to call us section, listing specific warning signs, excessive bleeding, refusal to eat. The more specific you are there to what you want it to say, again, you can put this in the rules, it will output more consistently. Tone is wrong for the situations. If it's a sensitive communication, tell it the tone you want it delivered in. I'd like this in a soft, warm, welcoming tone. I'd like this in a tone of condolence, whatever it may be, right? And if its output is too long, pet owner won't read it, as we just saw, right? If you send them home with a tome, the likelihood they're going to miss something is it increases. The likelihood increases. So if we can create a more concise set of instructions that are easier to follow. That's why I, again, tend to have pre-formatted and then just add the recommendations for that specific pet above it. It tends to make it something that they can easily digest. And again, client communication best practices. So we've got a few here. Specify the audience, right, for pet owners with no medical background, right to a 6th grade reading level, right to a 8th to 10th grade reading level. Include when to call us. Every discharge message should clearly create those warning signs. Using patient specifics, pet name, procedure, medications, and follow-up details, right? And again, you can create these in the rules once you get that started. Prompt for the scenario. Is this lab results? Is this surgery discharges? Consult follow-ups, review requests. We don't want just general broad-based generic emails. We want it specific to that instance. And then review the tone, which we already talked about. All right, so kind of key takeaways here. Framework, use the four-part framework: role, context, task, and format, right? If you can remember those four things, use of AI will get inherently easier. If you take nothing else away from this, that component right there, right? Remembering those four things: role, context, task, and format, will significantly input or increase the consistency, results, speed, and decrease your editing time. Okay. Um, so format, split prompts by, this is kind of specific to use cases in the clinic, split prompts by role and scenario. A tech intake prompt and a vet assessment prompt will be very different. Clarity, be explicit about what to include and what to leave out. Telling AI what not to do is just as important, right? Think of it as, again, that baby, that new associate, or like one of your children where, well, you didn't tell me not to do that. Well, yeah, I assumed you would not decide to jump off the bed and try a backflip, and here we are at the ER again, right? Unfortunately, sometimes you got to give those guidelines. Um, and then iterate. So when it's not right, iterate. Don't give up, add a line, just tighten the constraints, give it a little more information, and save what works. Create those templates based off what works. And again, templates. Start with the library that we're going to kind of provide here shortly, and then customize to what you need. You don't have to write prompts from scratch. The one thing that I'll also tell you that we didn't really go here, when I'm struggling with a prompt, I go to whatever I'm using, ChatGPT. I tend to use that, or I tend to use Tails, and I start having a conversation with it. I'm trying to generate this set of information. This is what I'm looking for. This is what, again, right now I'm being a little generic, but let's say I'm struggling with a lab output. It's just not doing what I want. We'll start having a conversation with your AI. I need help writing a prompt for lab work. What information do you need from me to create a consistent report? And start having that conversation. And once you get to a point where the results are what you think it may be, hey, are we at a point where you can give me an example of what an output would look like if I provide you with a set of lab results? It'll tell you yes, you input those, see an example. If it's not right, go back in, tell it what it did wrong. Okay, I now need you to edit that prompt that we created based on this new set of information. When you're able to do that, save that prompt, put that somewhere. And that tends to be how I find I'm able to create extremely, extremely consistent prompts, because AI had a hand in generating it. And I'm not assuming, right, or inferring that it knows something that I didn't expect it to. All right, and so now we're back at the Q&A with a couple minutes to spare. I do have a few minutes after as well, so if we need to go a few minutes longer, no big deal.
Awesome. Okay. We got two quick ones that I think we can fire through quickly. So the first is from Emily, and she said, when you make your discharge instructions through Tails, instead of the discharge notes button inside the soap itself, do you then copy the text and save it in the patient's file? Or how do you save those notes for continuity so coworkers know what information was sent home with them?
Yeah, so for example, there's this little thing up here called text plays, right? This is actually something that I did with Digitail early on, before a lot of the AI stuff was included in AI 5 years ago. And so I'm able to utilize text plays. So our group as a whole has access to this, right? And we have it in everybody's browser. And so it allowed us to create just like quick little notes on saying, hey, I want to send home a piece of information on balance it. Well, when I go to the recommendation section, they can type in \balance it, and it's going to create an exact thing every single time, right? So I can tell my assistant, yeah, I need you to send home recommendations on balance it, on canine limping. We have one on that where it creates a set of recommendations that I use consistently, right? If it's stuff that I find that I'm recommending the same way and the same recommendation, we save it here. And then they know, yeah, \encore for encore mobility, \balance it because I'm trying to, a client wants to do an at-home diet and I need them to help fill it. And then when that goes into those recommendations, it saves into the general SOAP note. And so moving forward, any of my staff can go back and look at that recommendation. The other part of that, right? They don't always have to go back and look at that. They can often at the beginning of a appointment just summarize the profile or click chat with Tails and have a prompt specific to that. But often at the beginning of appointment, they'll come in, summarize Gracie's profile, and it'll pull up, from the most recent recommendations, what we've talked about, what was the last visit. And that's typically how we operate so that it goes into that account and never gets lost.
Excellent. And then one final question here. Uh, Within AI, how successful is it at identifying the prompts it needs to improve the output? For example, asking AI, whether you're using GPT or Claude or Tails, what can I add in, task, context, et cetera, to improve my output and align more closely with the blank? In other words, higher standard of care, inputted clinic values, and then fill in gaps of what might not have been considered as helpful for a client or for documentation clarity. I think I think the core of that question is getting at how helpful is AI at actually improving prompts, which I think you addressed in one of your comments earlier, right, Dr. Doug?
Yeah, I think it's extreme as long as you're conversational with it, right? Especially while you're trying to create those prompts and you specifically tell it what you want differently. It has significantly helped me create more accurate prompts. I think it
Yeah.
is very, very helpful, very good. It does tend, for example, too, you can give it, you may have one that, you've worked really hard on an email, give it that example of what you did there, right? Even if it was pre-AI to say, this is my typical output, right? Personal output, based on what we've talked about for the prompting, right? That we're trying to create. What haven't I given you that would create something like this, right? And have those conversations, and it'll have actually meaningful back and forth to help you narrow down what needs to be in there, verbiage wise, language wise, whatever line needs added. It does a very good job of that. And so sometimes I do find that taking information you've already generated that's correct, right? And you're not in that instance, say we're not worried about the exact data point from this, but I want the general formatting, the tone of voice. What would you use to create that consistently and have that back and forth with them?
Excellent. Okay, on that note, I know we're just past 1 o'clock. So first of all, thank you again, Dr. Doug. Extremely helpful. I learn something new every time we talk to you, and I'm sure many of the folks on the webinar today learned a ton from this session. I'll leave with two things. One is that in the follow-up email, we're going to be sending to everyone who registered for this webinar, whether or not everyone was able to attend, we're going to be sending a prompt library that has 100 plus of these prompts. A lot of these prompts are structured in the way that Dr. Doug mentioned today. We've worked with hundreds of veterinarians to refine them over time, but they should serve as a starting point for a lot of what you're trying to accomplish in clinic. Of course, you'll likely want to customize them to your own needs, as Dr. Doug mentioned. But hoping that gives you a leg up as you begin your journey into AI. So that will come out in the follow-up email along with the recording. And then on the final slide, I just want to emphasize Dr. Doug is obviously an excellent resource to consult. And so whether you're starting a new practice or you're currently in practice right now and want to get a sense of how to improve operational efficiency, he's kindly offered to connect with anyone who does want to address any challenges in their clinic. And as you can tell, an excellent resource. So thank you all again for joining us today, and stay tuned for the third edition of this webinar series, which will be dropping in the next 6 weeks or so. Appreciate it.
All right. Thank you all. Thanks, Mike. It's been fun.
Thanks.